Hi guys, welcome. I'm so glad for those of you that are joining. Sorry, don't have the best setup. I was trying to do it here. Let's see if I can do it here because I can sit and talk to you guys better. But my little one is over there in the corner and she's being a punk. So I wanted to hop on here quick and share with you. I've been doing a lot of research for my blog. A couple programs that I'm developing to make sure that I'm hitting all those really important parts that are not being shared with us moms, whether we are looking to become pregnant, whether we are newly pregnant, whether we are postpartum, or anywhere in between, honestly. And even if we're like, our youngest is 4 years old, just information that really should be given to us, but it's not. And it's not necessarily for the doctor, the OB, to provide for you, but I think it's something that should be brought up to you. And I think the OB should be giving you an information, like a guide to be like, okay, so here's where you can go, or here's who you can go see if you're having these issues, or if you want to prevent these issues, here are some things that you can do. So me being a pre and postnatal corrective exercise specialist, and I honestly really got into this during the pregnancy of my last little one, my number 3. And because I was suffering from all of these issues, and I've had 3 back-to-back babies, so that's a lot on my body. But I did things that I shouldn't have done. I pushed through things that I shouldn't have pushed through, but I just kind of thought it was like normal. And I just thought that's what you do, just to keep pushing, right? So, don't push yourself. Okay. So I want to go over a few things. The first thing is to properly breathe as a whole, as like a society. We, as a population, we are becoming chest breathers. Okay. So what that means is what we're doing is we're breathing through our chest, when in reality, our diaphragm, which is here, is what we should be breathing through. But what happens is, as evolution has gone on, we've gone from like the Stone Age, the farming age, and now we're sitting. We are sitting so much. And that causes us to breathe incorrectly. That causes us to have a lot of imbalances in our body. So when you're sitting too much, like our glutes, our butt cheeks are not even firing correctly, which is causing pain in other areas of our body. Amazing, right? Who would have thunk? So, what are you doing over there, little one? So the first thing that you need to do is to start breathing correctly through your diaphragm. So especially if you are pregnant, this is something that's really, really beneficial for you. It's beneficial for everyone, but for that perinatal population, it's so key, because you want to be engaging your abs the correct way, because you're expanding for baby. And then after baby comes out, you want to be able to work and bring that belly back in, right? Our bodies are amazing, but we need to be doing the correct things so that it can all kind of go back into place the right way, so that we can feel good, right? So number 1 is to properly breathe through your diaphragm, and that's really just a feeling. So you just want to be taking a deep breath, and on the inhale, you should be, your whole abdomen should be like feeling coming out a little bit. And then on the inhale, on the exhale, it should all be going in. So it's just, you put your hands here and you just want to practice that breathing in and out. Feeling the diaphragm fill up, which is here, almost like your ribs are expanding, down through here is expanding. So And if you can see my hands, you can do that. So that's just where you should start. And that's something that you can really, it's very meditative. And you can start anywhere. You can start while you're driving your car. You can start anywhere. So the other thing that I want to discuss is when you're activating your diaphragm correctly. So during pregnancy, okay, let me back up a little bit. During pregnancy, and I have this picture to show you. Shoot, where did it just go? So I wanted to show you like the true. Okay, so this is a picture of our core. Okay, so we have. Let me see if I just, because I'm talking backwards. So the abs that most people think about right here, that's your rectus abdominis, like the six pack. But if you notice, it's the very top layer of your abdomen. Then we have our transverse obliques. We have like inner obliques. And then this big guy in here, the very, very inner is also known as like a corset. It's called your transverse abdominis. And that is what we want to be working. That is what needs to be super strong in order for the rest to be strong. Because if that inner corset, especially when you're pregnant and you're expanding, you want that to be strong because that's what keeps everything together. So what happens if you're not breathing correctly, all of this stuff kind of gets out of alignment, and then that inner corset can kind of wreak havoc on everything else. It can make everything else kind of pop and disjoint out of place. Now, the other piece to your whole diaphragm and to the inner course, the TVA and breathing correctly is your pelvic floor. Your pelvic floor is on the bottom of your diaphragm. So you have your lungs, your diaphragm, and then you have the pelvic floor here on the bottom. So let me get you a picture. I want to show you what your pelvic floor looks like. Images. All right. So here's a picture I'm going to show you. So here is a picture of the breathing. Okay. Here's your pelvic floor down here. Let me get my little pointer out. Here's your pelvic floor. Okay. Here is your TVA. So when you're breathing through your diaphragm, this should be going in on all sides, okay? And your pelvic floor should be going up as you are exhaling. And then as you inhale and you're relaxing, everything should go out and your pelvic floor should relax. And then when you breathe, when you exhale, you tighten your corset, you tighten your diaphragm, your pelvic floor contracts in. So if you're not aware of your pelvic floor, if you're not breathing correctly, what happens is that pelvic floor, there's so much pressure on it. And what happens if you're not breathing correctly is either it's super tight or it's super lax. So say you have this system. Say you become pregnant and you're not breathing correctly, and then you have this system that's not working, and you're growing a human, and you add a baby in here. You add a baby in this mix, right? Let me see if they have one for pregnancy. Well, here's the bottom. Okay, this one's a little better. So you add a baby in this mix, right? And it's growing. Everything is expanding. You think down here, the baby's head is down here. So you have all that pressure. And if it's too tight, a lot of like athletes tend to have a very tight pelvic floor because they're like constantly clenching, which can be an issue when it comes to like the labor and delivery. And that's where a lot of times we end up tearing and stuff during birth. So it's really important to be able to activate that pelvic floor correctly so that during your pregnancy, you are building that strength, because it's like a muscle and it needs to be strengthened during and after, because after pregnancy, so regardless if you got a tear or not, a lot of women experience leaking. Rosa, she's over there in the corner. Hey, girl. Incontinence. You might experience prolapsed bladder. All of that is due because you have a weak pelvic floor. And it can be fixed, obviously. But if you're experiencing any of that, obviously go see a physical therapist. And I highly recommend that to anyone to begin with, whether you are just find out you're pregnant or if you are postpartum and experiencing those things. So sorry, I'm kind of digressing, but it's the main idea I'm trying to get to you guys is that your diaphragm is where you should be breathing through. It's important to remember that you want to be working that transverse abdominis. You got my notes? You got my notes, girl? Did you poop? Because as I'm going to go back to that picture, because what happens if, oops, let's go back to that transverse. What happens during pregnancy is that everything stretches out, right? Oops, I don't want to ultrasound. Transverse abdominis. Here we go. So what happens, this area, the most outer layer, okay, right here, this right in the middle, there's no muscle right here in the middle. It's called a linea alba, and it's literally fascia. It's tissue. And what happens if you're not breathing correctly and your core muscles honestly like become disengaged, what happens is during pregnancy, the baby is pushing out. So that fascia is very weak. So it's going to just keep splitting and splitting and splitting, and all of your inner stuff is going to push out, right? So then you have the baby and it kind of sinks back in, but then you're kind of left with like this very lax fascia, and your rectus abdominis might be split, and a lot of people refer that to as diastasis recti. Now, diastasis recti is not caused by like the actual baby pushing through. That has part of it to do with it, but it has a lot to do as like a whole body solution. So it's our posture, it's our breathing, it's how our pelvic floor is working. So it's really a whole body thing, and it doesn't have to happen. So that's what I'm trying to get across too, is that these things can be prevented. The leaking after baby can be prevented. If you have a prolapsed bladder, all those things can be prevented if you are doing the correct breathing, the correct core breathing, correct exercising throughout your pregnancy, and rehabbing immediately after baby. And rehabbing in the sense of you refocus on that breathing and bringing those core muscles together again, because it's a muscle. It's made to work back and forth, right? And it's just the more that you work it, the tighter it's going to work. So the tighter it will work around your baby. So then after baby comes out, the tighter it will close back up again. So that's really all I wanted to share with you. And there's so much, I could talk all day about this topic, and it's kind of becoming like a thing now. Especially in social media, you're going to see all these people posting like exercises to do, like core, TVA, and all of that. But it's really important that you know the right way to do it, because if you don't, you could be doing more harm than good. So if you're not sure, please reach out to me. Reach out to a physical therapist, have your OB refer you, reach out to your OB. There are some other places on social media. The Bloom Method is really good. Nancy Anderson Fitness is awesome. They have great information about that. And what's the other one? Erica Zeal. I think she like Knocked Up Fitness. I think that's what she does. They all work on that right engagement. Fit for Birth is another one, and they're the people that I got certified through. So go to those websites, and just check them out. But don't be afraid to go see a physical therapist. And because if you're not sure how to engage your pelvic floor, if you're not sure how to breathe correctly, they can help you. They can assess you, look at you. They can look at your posture and everything and be like, okay, like this is where you got to start, girlfriend. And if you don't know how to engage your pelvic floor, they can literally help you do that. So it's a process, but it's a very important one because you guys, pregnancy and the postpartum period is it's such a blessing and it is such a special time. And I wish that someone had told me when I had my first that just to embrace it and it's okay to slow down and don't push yourself through all these things. Like I ran until I was 35 weeks pregnant with my first. I was coming off of running, 3 full marathons. So I was very well trained. However, it took me a really long time and my pelvic floor still is a little wacky. But I could have avoided all that. So that's what I want to put out there. And I think it's okay to know that leaking, jumping, like if you go back into jumping and all that stuff, peeing your pants after baby, a lot of times people are like, oh, welcome to motherhood. It's not normal. Okay. It's normal, but it doesn't have to be normal. So with, oopsies. With that being said, I will be releasing my Core Restore program shortly. And what this does is it will, from day 1 of having a baby, it will walk you through those first 6 weeks. And then I have another 6 weeks where it's just gentle exercises, gentle healing, how to get that core feeling good and strong again. So you're not suffering from incontinence. So you're not suffering from low back pain. So you're not suffering from, like the poor posture thing, like having pain, a weak core, all of that. It literally just teaches you a slow way to get re-engaged with your body, to get that strength back. And it just in a really safe and effective way. So I'm going to post that link below, but thank you so much for hopping on. If you have questions, please feel free to message me. You can email me wellness@caitlinspano.com. I love helping people. I do my time right now is really limited, but I do have one-to-one calls with women and I can assess you with your muscle imbalances and I can do that. If you're local, obviously I would love to see you in person, or we can do it like this via Skype or whatever. So thank you for joining. And ladies, don't forget about your pelvic floor and I will see you all later. Peace.